Good afternoon. My name is Rich Collins. I'm the Emergency Services Director for Sarasota County, and joining me today is our Health Officer for the State Department of Health in Sarasota County, Chuck Henry. Chuck, thank you for joining me today.
Thanks, Rich, and good afternoon.
It's great for you to join us. I think today is a big day for us, and why don't we talk a little bit about where we're at with vaccines and taking care of our citizens over 65.
Well, it is a big day because today we crossed that mark of 50% of our residents age 65 and above receiving at least one dose of the vaccine. So that's a big mark. We have 160,000 citizens, residents over the age of 65. So our current vaccines for those 65 and above has exceeded, I think, about 86,000 now. So we're really excited about it. In addition to that, overall vaccines for residents of our county have crossed the 100,000 mark. So two big numbers today that we're real excited about.
That's a lot of work by a lot of folks, and I know our citizens are very concerned about making sure they can get in line to get their vaccine over 65. And we've had a lot of information this week through the governor's office on changes that have been updated as part of the executive order. And I think what I'd like to try to do is maybe we'll go to the website. As part of that, we have actually updated the website so that it's a little bit easier for citizens to find information. I think as citizens go in, they'll notice we have obviously the screen here, and you'll see that we're up to 82,904. We're going to talk a little bit about that in a couple minutes. And our citizen can go right to this click box here for first dose or second dose information. So all of that information's there. And then we've added the vaccine priority groups because of those questions. We're getting a lot of questions on what it means from the executive order. So why don't we spend a couple of minutes and talk about that. As residents go to this page, they'll see the vaccine priority groups with information, links to how they can set up appointments at pharmacies, and then we've added the additional areas that the governor's talked about. So why don't we start off, Chuck, by talking about teachers, schools, and day staff. How's that looking, and how can our residents that are over 50 teaching get their vaccines?
So I think it's really important to note in the state of Florida, the executive order was expanded now to include teachers over 50 or school employees over 50. So that's a big group, but that's different than at the federal level. They've expanded things federally to cover all educational aspects of all ages. So teachers, preschool, college level, the whole bit. Here in Florida at our state sites, which includes our mall site and those run by the health department, we follow the governor's executive order. So we're focused on those teachers over 50 or those school employees over 50. Others in the community can go to the nationally supported sites. The closest one to us is in Tampa. There's a federally supported site at the Greyhound track in Tampa. They accept walk-ups, so people could arrive there and seek a vaccine. If they're an educator or an employee of an education institution and they're not age 50 yet. They can also go to Publix, Walgreens, CVS, Walmart, and links to all those are also available on the county's webpage.
So I'm just going to try to unpack that for a second. There's a lot of different places we can go, right? So if I'm a school teacher in Sarasota County, right now I understand that your team is working with the school district to take care of and how they'll deal with teachers in the schools as well as the private schools.
I'm glad you mentioned that, Rich. For that is absolutely correct. For those teachers, private and public in Sarasota County, age 50 and above, school employees, not just teachers, school employees, we're working with the state to bring a vaccine program to them so that they'll be covered in what we call a closed pod. And so they don't need to do anything except stay tuned with their organization to get instructions on when that's going to happen.
So that's excellent. And then on top of that, I could go to a retail pharmacy and get in that system, or I can go to the state site. And to meet that federal side, if I'm under 50, I can do that as well.
That's correct.
Excellent. So we've covered teacher, school, and day staff. Let's talk about most medically vulnerable individuals over 65. So how's that working?
So the medically vulnerable between 16 and 64, they have been eligible for vaccines for a while through hospitals. The number of vaccines available, though, has been a trickle. What changed in the governor's order is there was a new form created that makes it easier for your physician to document your need for the vaccine if you have a vulnerability. Once you have that form, vaccines are still not flowing freely everywhere, but they are available. You can take that form and you can get appointments at any of the Walgreens, CVS, Walmart, any of those outlets. You can take that form to the federal site in Tampa, and again, they take walk-ups. And we're working hard with our area hospitals and area medical practices to try to get more vaccine distributed out amongst them so that they can provide those services too. And so I ask people to be patient and stay tuned, because over the next 2 weeks, you should see more outlets coming online that would make services available to that group, 16 to 64, that have these doctor's notes already completed.
So what I would do is, and the vulnerability form is right here on our website, so it's going to take me out of the site here for a second. It'll take me to that form, and here it comes. Maybe a little slower today. There's the form. So this is the form. You can get right to it from our website. I would fill that form out. Then I would take it to my doctor, get it filled out, and I could go to any one of those retail sites or the federal site up in Tampa. And one of the things we've done is add a page with direct access to all the places where folks can go to get that through those pharmacies. So that's just another way we're trying to help folks. Let's take that last group, sworn law enforcement officers and firefighters at least 50 years of age. Right now, you're working with the respective agencies to handle that.
We are, and we're working with our cities and with the county to set up, again, what we call a closed pod to take care of those. There's not a huge number in this group that are over 50, so those will be taken care of through clinics in the next 2 weeks. And again, we encourage those individuals to stay tuned with their organization for instructions on where they should go and how to do that.
That's excellent news. So we've covered teachers and school staff, we've touched on the vulnerability, and we've talked about law enforcement officers. Let's take a second. Let's go back to the front page and talk a little bit about where we're at. We're up to 82,904, but we've seen a number of registrations where when we send out the registrations, they're either not available or they decline the appointment. And that's a big issue for us. And can you talk a little bit about why?
Sure, it's a big issue for us because every time we have an event, say if we have 2,000 doses available at our mall site in one day, and the registration team sends out 2,000 opportunities and only 1,000 confirm and 1,000 opt out or say not available, then they've got to go through a process to send out additional reports. And typically now they're doing that 2, 3, sometimes 4 times to get 2,000 confirmed individuals.
You know, that's really, really important point. On Sunday, the state is supported. When you just think over the last several days, I think we have over 7,000 vaccine registrations going out. Just on Sunday alone, to put 5,000 out, we've sent out over 10,000 potential appointment registrations to get to, and I think right now the team's trying to backfill again. We're sitting at about 4,800 right now. So we're getting close. But the real important thing is if somebody's not interested, if they've already gotten the vaccine or they don't need it anymore, to please delete themselves out of the system and take themselves out, right?
That is so important, because if everyone would do that, then it would really cut down on the workload for our reservation team, and it would make it easier for us to ensure that we filled every slot available at the clinics. So then we move through these numbers even faster.
Yeah, so I think next week this number, we have a number that either declined or unavailable. So next week we're going to have to go back and try to fill those with those individuals before we move that number again. So that's part of the issue, I think, for us, right? Trying to make sure we get out quickly.
And on the webpage, there are links to videos, instructional videos, and one of those instructional videos walks you through how to delete your account in the Everbridge system. So I encourage people to look at that and make sure if they've already received their first dose somewhere else, please go in and delete the account. If you got your first dose with us at one of our clinics, you don't need to do anything, because we'll use that information to send out your second dose notice.
That's great. So let's talk a little bit about next week as we begin to wrap up here. So next week, we've already put out appointments for 2,000 a day, first dose, Monday, Tuesday, Wednesday. I know there's a lot of folks that got shots back in February that are saying, hey, my second dose is coming up. And that's coming up next week. Can you talk a little bit about
So
that?
for those that got vaccinated at our clinics, February the 8th through the 12th, I think, was that week. Your second doses are due this week, and we're putting together plans for second dose clinics on Thursday and Saturday and possibly Friday. So we may do Thursday, Friday, Saturday. We have about 7,000 people due for their second doses, and so we'll probably use all 3 days to get through them. And you'll all receive appointments from the Everbridge system telling you which day and what time to show up. That's really important because if you just show up and you're not on the appointment list, we try to accommodate, but it creates a problem. One day last week on the second dose day, we had over 300 people an hour showing up, and it exceeded our capacity to move people through in a fast manner. So we ask people to watch for those appointments and then come 15 minutes before your appointment time, and things will run smoother.
You know, you bring up one final point I want to talk about. You know, we're sitting now at about 13,000 doses or more a week coming in, which means
First doses.
First doses, which means 28 days from now, right? We're talking about those 13 doses coming back plus first doses. So what are we doing and looking at downstream how we're going to handle that? Or what are we exploring on how we're going to deal with that?
Well, that's a great comment. We're actually working through the county to look at the potential for more space at the mall. So we may be able to have a first dose and a second dose space because, as you said, in a few weeks' time, we're going to have 20 to 26,000 doses to distribute every week, first and second dose. And in our current space, our capacity is about 2,000 doses a day. So 7 days a week, 14,000 doses. We can't get there in that space alone.
So we're going to look at expanding that. So
Absolutely.
We're exploring that. I think the other thing people are really interested in is the governor's next phases. And I know both our teams are working very closely on that. I want to talk a little bit about that for a second.
So the next phase is, of course, we all can go to CDC's website, and I encourage people to do that. Lots of information there, and you can look at what are the recommendations at the national level to be considered for the next phases. And those are all helpful. I can't predict what will happen within the state of Florida and what will be in the next executive order. But I can assure you that as soon as the executive orders are adjusted, expanding either more people or moving to another phase, we'll be moving rapidly to get those vaccines out to that group as well. And in fact, I know that your team's already working behind the scenes to put some things in place that'll help us do that.
That's awesome. We really appreciate that partnership between the two of us. And I think that leads us to the final point. You know, obviously we can go to the website to find any information you might have. We have our VAX line, 861-VAX, V-A-X-S, 8297, that you can go to for further information. But as we leave today, I think on behalf of both Chuck and the county, we'd like to thank all of our citizens for working with us and having patience as we work through the registration process, getting the shots out on the street and into arms. And a huge thank you to all of those that are helping us, our volunteers, staff working behind the scenes to make this happen each and every day across the county, and our state partners as well. So with that, we're going to finish up. Chuck, thank you very much. Everybody, please have a great day and take care.